What are the risks of having a mole removed that is located in the center of my spine? Yeah, I mean, a mole is absolutely no problem at all because a mole is a skin thing. So you can remove a piece of skin anywhere you like. Just because it's over your spine doesn't make it any more um, of a risk or more of a problem. That's absolutely fine. I mean, we did one the other day of a large lipoma, and I think that would have more of a so a mole, no risk at all. If you're worried about getting their nerves and things like that, you know, a mole, as I say, is a piece of the skin, so it's nowhere near the nerves. You don't go anywhere near the deeper structures. A subcutaneous lesion, which either assist or well, not, actually assist is really cutaneous, but something that's underneath the skin. So a lipoma would be more of a thing, would be something, or something that's a lump that's underneath the skin would be more of a worry. And so that sort of thing we would ask for a scan for if you had a lump over your spine, because you want to make sure the lump isn't, you know, nerve, isn't basically a neurofibroma or some nerve tumor or something like that. Or a bone tumor, although it'd probably be bony hard if it was, you know, of your spine. So that's more of an issue. And also look at its relationship with the nerves in the area, because we don't want to, if there was any risk of that, then we would probably be more likely to do it under general anesthetic and more likely to counsel you as to whether it's worth taking on the risk of having it removed at all. So that would be a subcutaneous lesion, just to see how deep it was and how close it was to the nerves and to check it wasn't part of the nerve. But for a cutaneous lesion like a mole, there's absolutely no risk whatsoever in doing it on your spine or whatever, you know, if it's right over the midline of your spine. Well, the only thing is it might be uncomfortable to sit back on if it's on the midline of your spine or something like that. So that's probably something to consider. But no risk with the spinal cord, which is, I think, I get the impression where the question's